Hi there. Wanted to talk about some medication options for alcohol use disorder or alcoholism, alcohol addictions. We call it alcohol use disorder properly as a professional, and there's really three main FDA-approved medications. That's not to say that there are other medications out there that could potentially be helpful, but three are approved for this purpose specifically for not only reducing time to relapse, but reducing the amount of alcohol that people relapse on. First one is naltrexone. Naltrexone is an opioid receptor antagonist or blocker. It's a different formulation of what's given for opioid overdose called Narcan. So it's the oral tablet version of Narcan, so it lasts a little bit longer. And it reduces cravings. One of the main side effects of it is potentially nausea, upset stomach, diarrhea. Could cause low energy or low mood or flattening of affect or feelings, but that's less common, but something that people need to look out for and talk about before they start it. The other one is called Acamprosate. Acamprosate is a glutamate receptor modulator and is helpful for that post-acute phase after stopping alcohol, where somebody might feel more restless, irritable, discontent, low energy, anxiety. So acamprosate is helpful when people have coexisting anxiety in the context of alcohol use disorder. And the last one is Antabuse. And Antabuse, like anti-abuse, is known to cause disulfiram-like reaction, which is a very sick reaction after you combined alcohol with this medication. There are other medications that could potentially cause this sick reaction, but this one is being used intentionally to avoid a negative circumstance known as negative reinforcement. And so one way that people could potentially use this is by taking it as a last measure, safety measure before potentially high-risk situations such as going to a bachelor party or going to happy hour, going to a wedding or an airport, and you would say, hey, I really don't want to drink during this event, and my logical side of my brain right at the moment right now doesn't want to drink, but I know in the moment when I go to the event there's going to be a lot of pressure there and I'm going to feel like I want to potentially drink, but if I have this medication on board knowing that I'm going to get sick, then I definitely won't drink. And so that's one reason that people might take this medication. And so there's naltrexone, acamprosate, and Antabuse.